So if I could introduce the second speaker, and I think it's just going to be Lisa. So it'll be Lisa Enoch. So welcome, Lisa. So she's Education Lead for Critical Care here at Cambridge University Hospitals, and works alongside Martha, who's the lead nurse at Malago National Referral Hospital in Kampala in Uganda. They're co-leads for the Kampala Cambridge Scale Critical Care Partnership. It's a health workforce development initiative between Uganda's Ministry of Health and the NHS. So access to critical care, as we know, is a crucial component of healthcare systems. But low and middle income countries like Uganda face a rising burden of critical illness, and the capacity to provide care for critically ill patients in intensive care units is extremely low. With the support from the Ugandan and UK-based organisations, including CGHP, the partnership is growing the skills and knowledge of the Ugandan and UK critical care health workforce through peer-to-peer learning and exchange. So Lisa and the critical care nursing team have just returned, I think, from a week's visit to Malago, is that right? Where they've been co-training with Ugandan faculty around 100 ICU staff from across Kampala. So welcome. Look forward to your talk.
Which one is it forward? That one. That one. Thank you, Sue. So I don't need to go through this slide now because Sue's done a very, very thorough introduction. So thank you very much about the SCALE project. So my journey in particular started in June 2022, and there I am stood with Martha Alupo, who's a sister at the Malago Referral Hospital. And our relationship started with a scoping exercise of the critical care units around Kampala. We visited at least 4 to 5 intensive care units, and including the nursing school at Makerere, and we had discussions with all the lead nurses and the head of the nursing education around what we could possibly provide or co-lead or co-produce together. While we were there, we were also fortunate to go out with Dr. Rowan Bernstein and Jed Byrne from HEE, and a memorandum of understanding was signed around the project of SCALE and the collaboration that we were going to move forward with. We went with a proposal of training to the universities and to the leads of the universities, offering these 4 options. We thought we were following the medical programme of the fellowship, and we thought that this would be really well received. And it wasn't, because the comments were, why would we want our nurses to leave Uganda? Why would we want our most skilled nurses to leave Uganda and come to the UK? So we had to think on our feet, and we had to come up with something new while we were out there. And this is what we did. So we also wanted to build in the sustainability. The whole ethos of the partnership is that we were able to move away and provide support remotely. So we devised online teaching programs that we run regularly. We introduced nursing grand rounds. We built relationships with key nursing staff. And we ran, as Sue just said, we've ran 2 programs now out in Kampala at the ICUs. And we wanted to train the trainer for stimulation and debriefing. The 2.5-year programme where a Ugandan nurse comes to the UK is still being discussed, and the benefits of that can be seen by some, but it's more us going in country and providing training and training their nurses to then carry on providing the training. We have 1 nurse who's out there now, Gail, who is there for a month to help in bed practice. Grand rounds is quite a medical model. It's not something we use in nursing, so not only was it new to us in the UK, it was new to the Ugandan nurses as well, and we have gained so much from it, more I'd say than the Ugandan team. And the Ugandan team choose the topics. Sister Alupo there chooses the topics that we should discuss. The conversation and the discussion that's generated is phenomenal, how we manage patients and the differences, and more so the similarities as well. In November, we were due to go over to run a 2-day programme, but Ebola hit Uganda, so that halted that programme. But we wanted to keep the momentum going. It was really important. We had the engagement. So we decided to run virtual simulation, something we hadn't tried before. Uganda didn't have a simulation suite, so we set up a simulation suite in our bed space, and Uganda were online. We ran the first simulation where we acted it out, as simulation is not something they had experienced before within that unit. And then the second sims, we asked them to guide our management and what we did, which is highly entertaining for both countries. But again, conversation, engagement, discussion around treatments, what's available, what's not available. All the time we're building these relationships. Eventually, we got to go to Uganda in February 23, and we devised a 2-day programme with the help of the Ugandan cohort, where they wanted to look at the deteriorated patient in critical care. So we, with Martha's and her team's guidance, we co-designed this programme. Over 72 nurses attended the programme, which had its issues, but we were able to manage, and we used multimodal teaching. So we did lectures, we did games, we did group work, scenarios, and here's some of the pictures of them enjoying their group work. We did some practical sessions on the unit, which was really important. The group work was, again, something pretty new to them, discussing ideas, management, how they manage things, how they felt about practice. Certificate's very important to nurses, so we devised the certificate. And there's Gail in the classroom there, so Gail with ECG, she's still in Uganda, still teaching. Our feedback was it was very well received. The training was, we were asked to come back, they wanted more training, they wanted more content. Challenges for us were time, the time that we had there, the time during the days. As Martha will allude to at the back, Uganda's run on a very different timescale to English nurses, and it was managing those expectations. Differing knowledge, there's very different units around Kampala, so some of the Malago nurses were extremely knowledgeable, and some of the outer units needed a bit more in-depth knowledge. Lack of Wi-Fi was a problem, and data's very expensive. Large group sizes and not enough facilitators. This is a really important slide for me. So as a lead nurse, this is the feedback from the nurses that we took to Uganda. It's so powerful taking nurses over to overseas to work. 2 of the nurses who have been quoted on this slide were extremely burnt out and suffering from PTSD from COVID. It was a perfect time for us to take them away. And they were probably going to leave the profession. Coming back from Uganda, revitalised, new energy, new viewpoint of the world, and we've managed to keep them in nursing. So moving forward, we took on board all the feedback from the previous trip. This time we went with more facilitators because we wanted to do more practice. CUH resus team very kindly gave us 3 low fidelity mannequins. Gail is there, still in Kampala, working away. And what we realised when we were there was actually it's not just the education. Some of these nurses are really highly educated, they're far better skilled and knowledge than we have. They just don't have the resources. But it was a culture change on the units, on the critical care units, the relationships between doctors and nurses, similar to some of our units. So we've just come back, and our focus was simulation, and this, it was a very robust programme that we provided. And here we are with some of the team. John there is setting up the mannequin. So John, we have trained now to run simulation sessions, and we have taught him how to debrief, which is the most important part of simulation. And there they are, all engaged. Some of these nurses had not have mandatory training is not applicable, so they had never had time with a mannequin to practice even basic life support, so even that was something substantial. Feedback from the team, the nurses that we taught, there's 50 pages, but these are a few key comments from them. And then last slide from me. So Martha's at the back there, and we're very grateful to have Martha in country with us, where she's observing our practice. And I think for me, these are two really pertinent quotes. When I first met Martha in June, she said to me, she took my elbow when we're moving from room to room. She said, "Come, let's move." We move together. And I feel that since June 2022, we have continued to move together. We're both the same. We're both lead nurses in a critical care. We both have the same issues. We have vacancy factors, we have bed shuts, we have critical care patients coming out of our ears. They're the same, but we're also the same in that we're passionate about critical care. We believe education is key. We're passionate about providing education and raising the profile of nursing, because without raising the profile of nursing, we have a global issue with recruitment and with nursing. So thank you very much.